I'd like to remind members, according to the debate arrangements, this debate will end at around 4:10 p.m. and at around 2:20 p.m. I will ask the public officer to speak, and after he has spoken, I would invite the members who've moved the amendments to speak again. And after they have spoken, this debate will come to a close. Ms. Alice Mack. Madam Deputy, I speak in relation to Mr. Raymond Chan's amendment number 130 and 140, and that is to cut the salary of the secretary and also the salary or the expenditure for the Healthcare Planning and Development Office. I oppose these two amendments. We talked about the uneven distribution of the X-ray and the operation of the X-ray, but we can't cut the pay of the chief executive of the hospital authority. And I don't think we should cut the salary of the secretary because he should not be the one responsible for the CEO of X-ray. Is getting a pay higher than the chief executive. Is making a mess of the X-ray. The staff morale there is low, and there are so many medical blunders. And every time when there is a medical incident, only the frontline officers are asked to face the media and the public. And there is a lot of public grievance. Dr. Kokaki said that the doctors in public hospitals have, say, 5 to 10 minutes to see a case, and there are some hundreds of people waiting outside, and they don't have enough time to see the patients. So several months ago, when we debated the budget and the policy address, I raised back then that when the queue of patients gets longer, and we're still asking the doctors to finish one case in 5 to 10 minutes, is that the right standard? Now, every time when there is a medical blunder, the doctors have to fill out some other forms as well, and the doctors get busy just filling out the forms. And this system must be improved. But then we should not, because of the problematic system, that we should cut expenditure. Well, doctors are human beings and they make mistakes, but then they are making irrevocable mistakes. This is a life that we're talking about. Can you give back the liver to the patient? Why are you using this excuse that doctors are human beings and they don't have enough time to meet the patients? No. Well, he said that doctors may make also stupid mistakes. We can't accept that. And because of your mistake, this patient has to get a liver transplant twice.
Last month, there was at the coroner's case a leukemia patient. I was assisting this patient. When the patient went to the A&E department, well, first of all, he did not receive a revisit certificate from the doctor, so his medical attention was delayed. And at the A&E department, the doctors were not alert enough to give him appropriate treatment. So he lost the chance of getting back his health. Even the coroner and also the professional witness, who was a doctor, said that the patient could have been saved. Yes, doctors are human. They can make mistakes. They face a lot of pressure. We understand. Let us all work to improve the system. But we cannot just say doctors are only human and that they are prone to making mistakes, but then the mistakes are irreparable. If medical staff are listening in, I want to tell you that we do sympathize with you because you face a lot of pressure, but I do want you to really apply yourself to your job, because your decisions have to do with the lives of people and people's families. And then what is the notification system after an incident happens, just like this case of Madame Tang Kwai Si. The hospital knew it. They did not say anything. Had the patient's family not asked, they would not say anything. And then they waited long to say something. And then they are telling you that this is not a notifiable case because it is not an act of commission but omission only. Oh, come on, please. This is an act of omission so that the patient would be prone to complications, so she might lose her life. And you're saying this is not an act of commission because it is not that the wrong medication was prescribed, but it is an act of omission only, so there was no need for notification. Come on. How can you gloss over your own mistakes? Just now, I talked about this leukemia patient. In fact, many medical incidents I assisted were such that when the patients or their families came to us, they might have come for a different reason, just like this leukemia patient. The family came to me because the patient had already died. They did not want an autopsy, and they came to ask us what they could do, and then we reviewed the case, and then we found that there was no schedule for a revisit, and then at the A&E department there was no medical attention after a few hours, and no medical attention even in the wards. And then we discovered all these problems. The family came to us for another matter, but we discovered this. And then had we not discovered it, the hospital would not have become accountable. And also I handled another case. The patient was in Castle Peak Hospital. He was under mental medication, and his blood sugar shot high, and he had a blood test, but then the report was not reviewed. And this patient had such high blood sugar level that he was suffering from a fever, and then it was at some level that it could not be quantified. And then the patient died. The patient's family came to see us, and they trusted the doctor. They did not know that the doctors could miss out on important information. But actually, the family came to tell us that they could not find the wallet of the deceased patient. And then it was after our investigation that we found that the blood test report was at the bottom of a pile of documents in a drawer, and it was not treated. And so the patient lost this opportunity to be treated. Had the family not come to us for a lost wallet, we would not have known anything, and the family would have been kept in the dark because the hospital would not tell. So this is not about pressure suffered by doctors. This is about whether the hospital has been accountable to patients and patients' families. They might want to hide the blunders. And we are worried whether this is just the tip of the iceberg. Is it that there are many other cases that we don't know about? Had it not been for the lost wallet, the mother of that deceased patient would not or never have known that there was this blood test report which was hidden from the attention of doctors, so her son was not saved. What I want to say is, we are talking about improving the system. If we just want to slash the salary of the Bureau Secretary and we do not look at the problems at the hospital authority, it's not going to help. This will not help things even if the Secretary is deprived of his annual salary. What kind of mindset does the HA embrace when it attends to these matters? Dr. Pierre Chan was saying that $50 billion odd was given to the HA, and it was a meager amount. Well, it's all right. But as I have always said, and it is not a matter of is a lot of resources or very little resources. It's whether it is correctly applied. And only 10% of the HA expenditure is spent on medication, and is lower than that of other countries. So where has the money gone? It is not spent on medication. Not much, anyway, is spent on medication. And it is also said that there are a lot of vacancies at the front line. A few weeks ago, we went to see the HA management together with our member organizations who are frontline support staff. And it is said that it's very difficult to recruit people. We understand, yes, because you have such a big workload and you always have vacancies to fill. If people don't come to the HA for the spirit of the work, then you should pay more to attract people. The CEO's salary is higher than that of the CEO of Hong Kong, and then the frontline workers do not have high salary rises in the past few years, and even those who have worked for a long time would have a lower salary than the new recruits. That is why you cannot recruit people, and then when something happens, you say you suffer from manpower shortage. This really boils down to whether you put your heart into improving the system. And Dr. Pierre Chan was saying it doesn't have resources, we should give the HA money. But it doesn't help even if we give you a lot of money, because it's all spent on salaries for the high-ranking people. If you use the money to increase the salary for the frontline workers, for nurses and doctors, so you give them a better remuneration package, then that would be the right way to spend money. So it's not a matter of whether you have sufficient funding. Some people also talked about rare diseases. As I was saying, why is it that in such an affluent society like Hong Kong, there would be people who have to die just because of lack of means for medication? This is unacceptable. So the government and the HA really have to think about how you want to treat these people suffering from rare diseases and their medical needs. And actually, I think there's something the LegCo can do. We are talking about millions of dollars for buying medication for rare diseases. In fact, if you look at other countries, their drug factories, in fact, can supply medical or medication support for such patients. If a pharmaceutical factory only makes medicine costing millions of dollars only, then it's also difficult for the government and the HA to pocket that. So in this system, we have to think of a way to allow our patients to be able to get the medication they need, and we also have to investigate into why the pharmaceutical manufacturers are fetching so much money for the medication they make. If they are allowed to continue to do this, I'm sure medicine will become just more expensive. We have to face the problem squarely, and I hope the LegCo can have a discussion on the pharmaceutical companies, and maybe a lot of people's interests are involved, and I will be criticized because a lot of people's interests are involved, and we are talking about millions, even billions of dollars to be spent on just one patient. Mr. Ray Chan is saying that we should slash the salary of the Director of the Healthcare Planning and Development Office. I would beg to differ. Well, Dr. Pierre Chan was saying the present term of government is pushing out so many initiatives at the end of the term, so we have a difficult time. You know, a lot of the initiatives have come from this office. If there is no salary to pay the people at the office, and you say you want to regulate private hospitals, that would be gone. And we are talking about regulating medical equipment and also manpower planning. That would also be gone. Therefore, we cannot cancel this HPDO. On the contrary, I would actually say that more authority should be given to this HPDO so that it can coordinate the work of the hospital authority, so that it can oversee the work of the HA to make sure that the resources are really spent on patients and on improving the lot of doctors and other frontline staff, including support staff, instead of allowing the HA to have a increase of salary for the high-ranking officials only. I will invite 3 more members to speak first before officials will be invited to speak, and then it will be 4 members making amendments or proposals for amendments to speak again. And then the debate will come to a close after that. Mr. Leung Chi Chang. Thank you, Madam Deputy. In this third debate, I'd like to speak on proposed amendments by some members, especially which has to do with Head 49 and Head 170. I would like to speak on these two, please. First of all, Mr. Shioka Chun is saying that for Head 170, Social Welfare Department, he would like to cut the earmarked expenditure for recruiting 8 retired disciplinary service officers to inspect RCHEs. That is the yearly estimate for recruiting these 8 persons. I think Mr. Shill has gone in the wrong direction by making this proposal. You remember that there was the abuse of the elderly at Cambridge Nursing Home. There was a lot of reaction from society, and after reviewing the work, it is of the view that there should be more people to do inspections. And at that time, in fact, there was a shortage of resources, and so the monitoring of these homes was not satisfactory. Now it is proposing to have more people acting as inspectors so that elderly abuse hopefully can be put to a stop. But if we are trying to cut that kind of funding, I think that proposal is illogical, and I'm going to object to it. Actually, in these few years, the administration has increased resources for the elderly. For example, in 2017-18, there will be $7.84 billion, or 7.2% more than the $7.3 billion the year before. This was what the Secretary said in his opening remarks. Well, still, notwithstanding the increase in resources, it's still like a drop in a bucket. It doesn't really help us improve elderly services a lot. I therefore think that the administration should provide even more resources for elderly people so the elderly can really feel the care and concern of the government and society. The DAB proposes that there should be better arrangements for governance of CHEs. We, in fact, did some surveys and we have made proposals for the LW Bureau. We said there should be a $10 billion fund to help existing homes to enhance the quality of their service and to increase manpower, and also to train more manpower for these homes.
So on this score, we know that for these residential care homes, the government is providing 40%, and the private sector is taking up about 60% of the market. And this is not adequate. Is the government able to increase massively the number of beds for the elderly people? I don't think it is possible for this to happen in the short term, nor would it be realistic for us to think so. So the government is providing the homes progressively. 9,000 beds will become available in the next decade. We must bear in mind that with such a long waiting time, those on the waiting list may not be able to make it. So the easiest way is to upgrade the private care services to A1 level, so that those old folks on the waiting list can be placed in the private sector homes. Now, for the private homes, the vacancy is something like 10,000 beds. They're unfilled because that quality of service leaves so much to be desired. Many people are not prepared to go in particular after the Cambridge nursing home issue. People are losing faith in the private sector service. So the government has to do something about it. The government wants to place the old folks into homes quickly. The best way to go about it is to increase manpower and to increase resources in a way that these homes can upgrade themselves to measure up to scratch. Many of the old folks on the waiting list would be placed in them quickly, so we don't have to build our way out of the problem. We don't have to train up the staff, and there is a ready solution staring us in the face, and they would be upgraded to measure up to par. And the old folks will stand a better chance of being able to get a place. Mr. Secretary, I hope that there is a fund of $10 billion to increase the manpower level and the quality level, and to improve the services in general. I think while we can cut the staff, we can still provide the better services. In many homes, the elderly folks are bathed individually, but if you can automate the process, bath taking would need less manpower. You don't need 2 staff members to bath one elderly person. And the high-quality homes are doing just that. They're making investment into that, but for the small-time businesses, they simply cannot afford it. So the government can upgrade the services in a way that they can measure up to scratch. Finally, in response to some colleagues' proposal to slash the pay for the SFH, and also they're commenting on the inadequate level of service. I heard from Dr. Kwok Ka-ki and Dr. Pierre Chan that since healthcare workers are insufficient, the healthcare services are in very difficult position. They are suggesting that because of the manpower shortage, the government should recruit massively. This is a step in the right direction as far as I am concerned, but what is not correct is that last year, in particular, Dr. Kwok Ka-ki, he's a physician himself. Last year, when we debated the medical practitioner registration bill, he objected to it, and as a result, we lost the opportunity to hire high-quality doctors from overseas. Now, we are running short of doctors in Hong Kong. However good you pay them, you can hire doctors from the private sector. That would take manpower away from the private sector. Their arguments are very flimsy. That their arguments don't have a leg to stand on. In particular, they said that the conditions for the foreign doctors may not be able to be sufficiently attractive, and I don't think this is correct. And this is a kind of erroneous line of thinking. I hope that we should stay calm and collected, and in view of the shortage of healthcare manpower, we have to do something about it. If we dig our heels in, the ultimate victims will be the members of the public. I hope that Dr. Kwok and Dr. Pierre Chen will be putting in the same direction with us. I think we have to set aside our differences and confront the issues collectively. While I'm talking about this, I met some healthcare workers, in particular doctors, recently, and they made some suggestions regarding psychiatric patients. And I hope that the secretary would have listened to this. He's a doctor himself. Now, for the mental patients, they're receiving pretty good service to start with. Many of them have to be on medication on a regular basis, but some of them would skip the medication thinking that they're okay, and they give up on their medication, and then they suffer from a relapse. I was told by physicians that the mental patients, when they suffer from a relapse, would see their brain cells being damaged, and as a result, they would suffer from further complications. And there are doctors who are concerned about these patients who suggested that we can use injection instead of oral medication. I mean, they can be given injection on a regular basis at the hospitals so that they will not be skipping their medicines. And this would cause a relapse very often. But injection would be costing something like $40,000 per year. And public hospitals will not be prescribing this because of the high costs, and they would just prescribe the oral medication. Now we have, if we have 40,000 patients, and half of them may be skipping medication on a regular basis, and the consequence is that these 20,000 people will be costing the healthcare service more. If they are prescribed injection, it would save us, in turn, save us quite a bit of resources. So, Mr. Secretary, I'm wondering whether you might wish to consider adopting this proposal and prescribe them with injection instead of oral medication. It is a misguided thinking to think that oral medication is less costly. Now, the injection doesn't really cause any side effects. It would be far better than the oral ingestion of drugs. I hope that the Secretary would heed our views and make improvements. Dr. Helena Wong. Madam Chair, I speak in support of Mr. Raymond Chen and Dr. Lau Siu-Lai's Amendment 116-117. This is the 5th year I've been here. Hardly ever will I propose to slash the remuneration of Dr. Ko Wing-man here, the Secretary for Food and Health. Mr. or Dr. Ko may be leaving the government, but I still feel obligated to support these CSAs. Over the past couple of months, the whole of Hong Kong are very concerned about the liver transplant undertaken for Madam Tang Kwei-si. It was very unfortunate, and what we heard seems to be pretty heartwarming, and there is very good human touch here. She has a daughter, underage daughter, who proposed to donate part of her liver to her mother. Now, there was this other donor, Madam Cheng, Momo Cheng, who was prepared to make a donation. And we had a cadaver liver donated to Madam Tang. We admired the Queen Mary Hospital for the successful operation. We feel that there was warmth and loving care in the community. We hope that Ms. Tang would be able to shake off the problems and become well again. Now, yesterday it was an anticlimax that happened. It was pretty shocking. And it was discovered that Madam Tang had to be put through all these agony while she had to undergo a liver transplant. She went to the hospital for a kidney ailment. She ended up having to have a liver transplant. We were scratching our head. And then United Christian Hospital, the chief executive bowed in apology, and it was discovered that on April 6th, they went back to the medical record, and it was discovered that there were 2 renal doctors at the United Christian Hospital when prescribing medication to Madam Tang, prescribed high doses of her steroid, but they forgot about these antiviral prophylaxis to prevent the spread of hepatitis. Now, we were very confused. Why is it that UCH doctors had to come out and bow in apology? She's in QMH. Over the past 24 hours, there were more and more revelations about the case. It was found that at UCH, when they were looking after Madam Tang in January and February, when drugs were prescribed, they omitted the fact that Madam Tang was a hepatitis B carrier, and they forgot about this antiviral prophylaxis. This is a very serious medical incident. Why is it that in April, when UCH was aware of the whole thing, and there was no announcement and there was no notification of what happened? And all these are really mind-boggling. We know that in 2007, October, the hospital authority has already started the notification of serious blunder, and there is a standardized protocol for the notification of these medical blunders. The paper was presented to LegCo, and there are 9 serious medical blunders that have to be notified. And in 2010, January, the hospital authority improved upon the protocol. Other than the 9 medical incidents, 2 serious risk incidents were added, and 11 categories have to be reported, and all the clusters and all hospitals have to, within 24 hours, make the notification through the notification mechanism regarding the 9+2 incidents that are referred to. Now, Madam Tang's case, does it fall into any of the 9 or the 2 incidents?
Going by the government's paper, well, it should fall under within these categories of 9+2. For the 9 reportable serious medical blunders, one of it goes like this. Mistakenly prescribing drugs leading to total or permanent loss of the functions of the organ or death. And second, leading to patients losing functions permanently. And then also, for serious risk incidents, for the 2 types, one of it is called, which can lead to death or permanent malfunctioning, which is caused by wrong prescription of drugs. So the incident, Ms. Tang's incident, should fall within these notification or reporting mechanism. How come that this serious incident is not reported to the within 24 hours. How come that the incident was discovered in early April and Ms. Tang's liver was in poor state and UCH didn't know what to do, and so she was sent to the QMH? And during this handover of the patient, they didn't tell the liver transplant team at QMH, admitting to the mistake of wrong prescription of drugs. And Ms. Tang's liver had to be transplanted because of this, and her liver function was lost permanently. So the incident should have been reported. They didn't tell the family members. They didn't tell the doctor who were taking over the case. How come that this happened within HA? It sounded as we have a very ideal notification system, but the systems and the doctors, the hospital's doctors, could choose to ignore it. I would like to know when Dr. Ko, you yourself received the notification. UCH said that on the 6th of April, looked at the medical records and found this out. We don't know whether it has lied. And for the HA, when was it being notified? Is it really on the 22nd of April? Or is it the Dr. Ko, you knew about this on 22nd April? Or is it that you knew about the details only last night? Well, if that is the case, it's great trouble. You should have your salary for the past few years deducted altogether. Dr. Ko said that you found this very regrettable. Well, these should be comments from the commentators and not from yourself. You are the secretary. You seem to be distancing yourself from the incident. You said that it's regrettable. You are a politically accountable official. HA has, or everyone in HA has to take heed of your views. Is it the HA is not being governed by anybody? You told us about this notification system. You said this is a transparent and open system, and anything untoward will be reported so that the patients will not be get hurt any further, and the problem could be fixed. You have the mechanism, but we don't know whether the mechanism is implemented. Now, if the HA knows about this only on the 20th of April, maybe Dr. Ko, you knew about this on the 20th of April. That's my presumption or assumption. How come that the HA had not complained about it? Is it that the HA was holding back the information? How come that the family members were not notified either? Nobody made any public apology until yesterday, when the hospital chief executive of UCH came out. Well, this incident is inconceivable, and we see that there is a mechanism, but nobody follows it. They are not reporting the incident within 24 hours, and we don't know whether there is any penalty. Are you going to penalize the doctor or the hospitals? What kind of penalty is it? We don't know. And how come that the family members were notified in the first instance? The family members should have every right to know about their family members' conditions. And across the different clusters, when a patient is transferred to another hospital, the team taken over was not notified either. And fortunately, we have the e-health record system. So I appeal to all in the community to get registered on that system. Because if a case is, say, being transferred from UCH to another hospital, then this hospital will, through the press of a button, will know through the system what has been done to the patient, what drugs have been prescribed. Is it because of this system that the UCH knows about what the doctors have done? Are they trying to be evading their responsibility? So, say if Dr. Lo Chung Mao and the QMH team had cured the patient, then this mistake would be kept in the dark and nobody would have to be penalized. Is this the case like this? I think there is a deliberate cover-up here. And of course, we hope that the Secretary and the HA could thoroughly investigate into the case. But what I'm more worried is that this incident highlights problems at every level of the healthcare system. At the first level, the two doctors, they are veteran doctors. They are associate consultants already in the renal section. And, well, one case is too many already. And 10 years ago at the QEH, there was a junior doctor who made the same mistake. The case was investigated into by the Hong Kong Medical Council, and the doctor was went scot-free that time. And the reason being because there were no drug guidelines for prescription of high dosage of steroids. So the doctor was let off the hook. But in the past year, I'm sure that you have come up with the relevant guidelines. And how come that these two doctors, veteran doctors, one doctor dealing with the case in January, the other in February, they haven't noticed this. All they need to do is to look through the electronic record system to find out that this is a hepatitis B carrier. And you have to prescribe another drug to protect the liver. Why was not that done? You have to get to the bottom of it. So this is the mistake first made by the doctors. And the second mistake, at the hospital level, how come the hospital knew about it only on the 6th of April? Why didn't it report the incident within 24 hours according to the established mechanism? It didn't tell the family members, the HA. So there was a problem again at the hospital level. Now, coming to the HA level, did it know about it only on the 20th of April? We don't know. How come that the HA didn't make public the blunder, so it got covered up again? So we should have known about all these in April, but today is the 10th of May, and we knew about this only yesterday. And the family members and the patients who are still suffering. So we call ourselves an advanced city. We should be proud of many things. But how come that there are problems at different levels? Of course, the fourth level, I would say, is at the Dr. Koh's end. Is it that you have not been capable of monitoring this, the HA, this big monster, so to speak? Are you in full grasp of how they work? You can't resolve the matter by saying that you are regrettable only. Doctors are not following the guidelines. So we wonder how many similar cases have they handled before. And in prescribing high dosage of steroids, have doctors followed the guidelines? Is this incident of Madam Tang the tip of the iceberg? Are there any more victims? I think Dr. Koh should instruct the HA to look into similar cases in the past 10 years. Mr. Roy Kwong. Madam Deputy, this is the CSA stage of the appropriation bill. All we can do here is to ask for a reduction of expenditure, slam areas which have not been done properly, and give you reasons for proposing to reduce expenditure. Head 22, there is a proposal to reduce the expenditure of AFCD. AFCD knows only about performing euthanasia. In 2015-16, they have caught 2,412 dogs and euthanized 2,421 dogs. So we come to this conclusion, and that is, when dogs and cats get to the AFCD, well, they will be euthanized. And people may ask, what else can we do in other countries and cities? They have this trap, neuter, and return strategy. So for TNR in Hong Kong, how can we implement it more effectively? We are just carrying a pilot scheme. How can we extend it to the 18 districts in Hong Kong? We need the will and determination of the AFCD, but there have been criticisms. Well, euthanasia is the most convenient approach. Now, if the dogs and cats are not being rehomed for a certain time in AFCD, then they should be euthanized, and then that's the way to solve the problem. Hong Kong is an international city. In this day and age, we shouldn't be seeing this happening. Gandhi has this remarkable comment. While how a city treats its animals will reflect how civilized it is. Hong Kong is a civilized society, and Hong Kong people attach a lot of importance to protecting the lives of animals, and this is something we should be proud of. Unfortunately, up to today, we still don't have the animal police set up, and we don't have any laws to protect animals. And the AFCD has to take responsibility for that. AFCD should protect animals, but conversely, it is doing otherwise. From the efforts or acts of the AFCD, I don't think they are doing this. So the colleague is proposing a reduction of expenditure on euthanasia by the AFCD. I support this. We should devote resources instead to protect the living rights of animals. A lot of Hong Kong people are very concerned about animals in Hong Kong. There have been so many newspaper reports on physical abuse or cruelty to dogs and cats. But then we still have no solution to catch the offenders. Some people say that we do have an established mechanism. The SPCA, the AFCD, and the Animal Guardian program of the police are working on that. But we question the effectiveness of the police's program. Many animals are being killed cruelly, and we might not be able to catch the offenders because we don't have a dedicated law enforcement body. The police's animal protection team seeks to tell people who are cruel to animals that there will be a dedicated team with the public authority to monitor them so that they would not be cruel to animals. At the same time, we lack an animal protection law. I don't think the AFCD is considering that at all. And when we talk about budget, now we would have to ask them, what are your plans, work plans in the next year? And Hong Kong people would like you to protect animals, but they haven't come up with any plan. They just stick to their old way of doing things, and they continue euthanizing animals and so on. So we hope that the AFCD can do a better job.
We expect our organizations not to do bad deeds. Well, euthanasia is easy, isn't it? It's convenient, but it's not the way out. There are other advocacies in society. Say we should have an adoption center, and TNR should be extended to all 18 districts, and also the series of measures I mentioned. All that can be considered by the AFCD. And also in this debate, we are talking about medical services. Of course, we are very much angered by our medical service provision. Just yesterday, we heard about yet more development of the liver patient, Madam Tang. At the initial stage, I wrote to the HA. I said that the daughter was very much hoping to save her mother, but she was not 18. Could there be any room for maneuver so that she could save her mother? Well, the rest is history, isn't it? there was another lady who came forward. When all Hong Kong was supporting Madam Tang, there was this very serious scandal that broke out yesterday. United Christian Hospital could have hidden something that happened at the beginning of April. And then in the middle of April, the daughter asked for help from society, and everybody was concerned about the incident, and yet was still hidden. And then even after the liver transplant, and when the family was asking questions, then they came out to say, yes, we omitted to prescribe certain medicine. Madam Deputy, I said at this stage, we should cut the budget, we should slash the salaries. If money should not be spent in certain things, and if there should be a penalty, we should mete out that penalty. How come there was an omission of prescription? How come with different levels in the mechanism, this serious mistake that indirectly led to the necessity for liver transplant for Madam Tang, how could it have been hidden? Madam Deputy, talking about medical services, there is a whole basket of problems. In the past few months, I assisted in many suspected medical blunder cases. We heard from families that they were so saddened and they wouldn't like to see what happened to their children happening to other children. And at the same time, I heard from frontline workers from public hospitals, they were asking assistance from me. They said that in certain wards, the usage rate was 170%. Some frontline staff had to brace risks to send me that information to let us know that when we should improve our medical services, where has the government money gone? It has gone to the wealthy, and the poor are becoming poorer. Over $10 million have been spent on the Hong Kong-Zhuhai-Macau Bridge, and $5.4 billion has been approved for the Disneyland project. And we are now talking about the Kai Tak Sports Complex. Even someone who loses the bid will be given comfort money, so to speak, of $60 million. If that kind of money is spent on welfare, education, and medical services, there would have been such a big positive impact for Hong Kong. But in managing our public finances, the average citizen cannot share the fruit of our prosperity. Just look at medical services. We are not doing well enough. You can go to the districts. You know what is happening at the A&E department, and you see what is happening in the wards. Many patients are crying out for more help, and not to mention the series of blunders. And even at this moment, the HA is holding a press conference to apologize further to the public. But what is an apology? An apology for a life. Madam Deputy, every year we have this debate on the appropriation bill, and this is the time for us to think hard how our money should be spent. But of course, you can list a whole series of white elephant projects, and you know what public opinion is, but then we don't have enough votes here in the council, and there is very little we can do. And that is why in the past few months, very ridiculous proposals have been supported, and I'm talking about increasing the salary of accountability officials. And also, we, of course, should also be talking about welfare today. There is no allowance for the annual persons. I was listening to the tenants of subdivided units, and then the administration would say, okay, there is CSSA, go for CSSA. If you are not at the threshold for CSSA, you can go for low-income family allowance. But then it's such a thick form you have to fill out, and not everybody can fill out the form, and singletons are not included. We used to have this allowance for people who have nothing. It is not a big sum, but it was okay for tiding these people over. But it was slashed and nothing was put in place to replace it. So there is not this allowance. Let us talk about the disability allowance. Just last week, there was a public hearing held by the Welfare Services Panel, and everybody said that there should be a disability allowance. Yes, but again, the application procedure is so cumbersome, the threshold is so high. You need to be hospitalized for a month, and then you would lose the allowance because you already receive medical attention in the hospital. Grassroots people are getting 1,000 or 3,000 in disability allowance, and yet we are so miserly with that, and yet we also throw billions of money into the drain. This is what you are doing with public money. Talk about welfare. And Madam Deputy, at this stage, yes, we want to take the administration to task where it has not done its job well. And I remain to be convinced, because you have spent money on white elephant infrastructure and you have turned a blind eye to the needs of the grassroots. We are talking about people's lives. And what is most angering is, of course, how we treat people with rare diseases. Just last month, some of these patients came to a public hearing here. They told us their own stories. They told us how long they waited, but they did not have the money, so they could not be treated. And shortly after that hearing, one lady died, and she leaves behind a daughter who has inherited his rare disease, but we are not helping them. It's easy for you to say something about rare diseases because you are trying to drag your feet, and so that in a while they'll all leave us, and so there will be no problem in your hands. Madam Deputy, it's easy for us to list all these sufferings of the grassroots in our society, and I just can't understand why we're still squandering our public money. And at this stage, we can only take you to task, and we can only cut the proposed budget. And of course, the accountability officials will not like this. They will not agree that they have not done a good job. But look, when we talk to citizens, we'll tell them resources are limited, so there could not be even allocation. But this is not the fact. Every year, year after year, you are giving money to the wealthy. You are only looking after the benefits of the rich and famous. As elected members, should we just watch this happen and do nothing? The grassroots in society are suffering, and you are not helping them in any way. Look at welfare, medical services, and even the animals who cannot speak. They are all waiting for us to help them. Madam Deputy, you are not spending the money the right way. This is all I like to say. Secretary for Food and Health. Madam Deputy, on this debate which has to do with health services and food and safety, etc. Some members have said that they would like to slash money from Head 22. We object to those proposals. We adopt a multi-pronged approach to promote animal welfare, and in managing stray animals, the AFCD has done a lot to control the situation, to minimize problems that could be caused to the public. The AFCD has also set up a dedicated team to launch public education and publicity to ask people to love animals, and also people should be responsible if they want to keep a pet. And the AFCD has also stepped up enforcement. those who are keeping animals without a license and those who do not treat animals well will be taken to task. And the FCD is also liaising with many different animal groups in order to promote the message and to arrange adoption of animals. In the last 5 years, the AFCD has caught 59% and 71% less stray dogs and cats, and also the animals which have been put down have decreased from for 68% and 77% respectively. The proposal is to slash the AFCD annual expenditure on euthanasia for animals and also for catching and treating stray animals. While I must point out that the relevant proposal will have a serious impact on the AFCD's management work in this respect, and it's possible that will compound the problem. On the other hand, some members are saying that they would like to slash the expenditure for different items under the FESD because the annual expenditure, and we object to it because the FSEH has a lot of responsibilities, licensing, cleaning, cemeteries and crematoria, and a whole lot other work. It is said that it would like to slash the annual expenditure for personal emolument, plant and machinery, etc. If that's the case, our work in the coming year to provide environment, hygiene, food safety, and also public cemeteries management will be affected. Some members have said that they would like to slash from head 139 the salary for the major posts in the FH Bureau. We object to the proposal because the food branch of the FH Bureau is responsible for surveillance on food to ensure food safety and also to promote fisheries development and also prevention of flora and fauna diseases. If the annual funding is slashed, our services in this regard will be seriously affected. And some members have said that they would like to cut from head 140, and that is the annual expenditure for the Director of the Healthcare Planning and Development Office. We object to that proposal because in terms of public health, the HPDO is responsible for planning and implementing the relevant programs in order to ensure public health and safety, and so that there will be continued development of the public and private medical systems. The HPDO under the health division is responsible for many different things, and they are also responsible for looking at the supplementary voluntary healthcare program, and it should promote and also implement manpower resources and to do professional planning for manpower supply. And also, it is responsible for amending the medical practitioners bill and in order to allow the HA to be able to recruit more doctors. And also, the limited registration would be increased from not more than 1 year to not more than 3 years. If the annual expenditure for the Director of HPDD will be slashed, it will affect the work I mentioned.
Some members express concern about rare diseases and also its medication. I would like the opportunity to say here that every year in the budget, in recent years, we have increased resources by $75 million to the HA in this regard. The HA will have to base their decision on a mechanism in the allocation of resources to medication to rare diseases and target therapy. They need empirical evidence basis before they can introduce the medication. There is also an expert panel in the HA to assess each case. A number of members have expressed concerns about a number of diseases. The hospital authority actually is doing something about it. In the short run, I believe that there will be some improvement mechanism put in place to benefit more patients in the use of medicine. I ask members to vote down the amendments in this debate. Secretary for Labour and Welfare. In relation to social welfare and poverty alleviation, this is the reply from the LWB. Poverty alleviation and assistance to the underprivileged has always been our focus. Compared to 2013-14, when there was $42.8 billion, in the most recent budget, the expenditure has risen to $73.3 billion, which stands at 71%, a lot higher than the 41% at the beginning of this term of government. It shows our commitment. Some members expressed concerns about resources allocated to the poor. Starting from May last year, well, that was the low-income working family subsidies scheme. This is an assistance in the financial form to help those with a low household income. There will be a review on this scheme in relation to the design and the operation of the scheme, and also implications on other areas. We will also collect views from the public and from relevant parties. Our policy is aging in place with homes as supplementary measures. We also adopt a new line of thinking. We will improve supporting facilities. We will launch the second phase of the community care service voucher for elderly people. The number of vouchers will be increased to 5,000 vouchers. Existing services will not be reduced. We will continue to increase the quota of healthcare services. In the 26 privately owned sites for welfare use in the coming 5 to 10 years, there will be an additional 9,200 REHC places and about 900 daycare places. In relation of overall planning, the Elderly Commission is working on the elderly scheme covering different stages of the life of an elderly. In the middle of the year, we will submit the plan. We also set aside $30 billion to enhance our elderly and PWD services. The elderly scheme and rehabilitation scheme will see a series of recommendations for improvement. It includes improvement of quality of RCHEs, mentioned by Mr. Leung Chi-Cheung. We would not lose any opportunity. We will launch timely and suitable measures to enhance our quality of service. In relation to amendments under Head 141, I would like to say that the LHB will focus on implementing various policies and measures to help the poor and the elderly, also PWDs. The Bureau will put in place a number of measures to promote employment, to ensure harmony between employers and employees, to ensure occupational safety. We will also endeavor to launch various schemes to help the poor and the underprivileged. The political assistance, the Undersecretary will provide support to the Secretary. Ms. Lau Xiaolai made amendments under 141 in the reduction or remuneration of politically appointed officials of the LWD. This will seriously affect the operation of the Bureau, so we will oppose to this amendment. Mr. Xiu Ka-chun, under Head 170, proposed to reduce an amount that equals to the amount to recruit 8 retired members of discipline services in the inspection of RCHG and RCHDs. Well, on the 2nd of May, we have set up a new team to inspect RCHGs and RCHDs to enhance supervision. There are 121 posts. That covers existing 80 posts and 40 new posts with various disciplines, say, for example, nursing and surveying. We have, by way of non-civil service contracts, employ retired members of discipline services to assist in inspections of these homes. They will also assist in collection of evidence and in prosecution. This will enhance our supervision. They will not replace our existing inspectors. Their salary was set at $36,000, which is lower than the majority of inspectors in the SWD. The licensing unit and the regulatory unit will launch new measures to inspect these homes, including ad hoc inspections. If we dock the pay for these retired members of discipline services, this will seriously affect the operation of our work. I so submit, and I ask members to vote down all the amendments in the third debate. Mr. Ray Chen, would you like to speak again? Thank you. Thank you, Chairman. In the third debate, I only proposed 4 amendments. When I moved the amendment, I only spoke once to explain about my amendments in relation to reducing the expenditure of the AFCD. In the future, if, Chairman, you have time to make arrangements for debate, please set aside more time for the debate. There are also 3 other amendments, including reducing the expenditure of the remuneration of the director of the Healthcare Planning and Development Office. Well, I have to quickly mention about this. I propose to dock the pay of the director of the HPDO because in 2011, when they received funding from the FC to set up this office, they were again funded in 2013 for the extension of its operation because it was set up to implement the healthcare planning and also voluntary insurance. The government set aside $5 billion to support the healthcare insurance. We can see what has happened so far. I'm not going to elaborate. I also propose to reduce the expenditure under head. I'll mention the head later. I'll come back to the redocking of the pay of directors. Back in the days when there were hundreds of amendments, I did not propose any amendments to dock pays of bureau secretaries. However, this year I have done it. For all the bureaus and departments, well, if it's about docking of pay, of course it will be at the end of the line. Ms. Lau Siu Lai, under the same head, proposed amendments to dock 1 month salary of the secretary. Of course, the loyalists will not support me. And if the Pan-Democrats think that, instead of docking 3 months' pay, it's more appropriate to dock 1 month, then you can vote for Ms. Lau's amendment. If you want me to talk about the FEHD, 5 hours is definitely not enough. whether it is frontline staff member or the management, there are many problems. Their mentality is calcified. They thought they have power. There was an incident that took place yesterday. For the private columbarium bill, we have finished the second reading debate. After this appropriation bill, we will go back to the bill. It was the director of the FEHD that's responsible for this bill, and yesterday he told us about what other work should be done. I have made some amendments. I have proposed some amendments, so did Mr. Leung Kwok-hong and Dr. Fernando Cheung. It's about the designated claimant. Should the columbarium closes down, who has the power to make claims? We will debate about the detail later. But at the end of April, there was a judicial review. It was Mr. Leung, a senior immigration officer. He said that his husband, they got married overseas, his husband should enjoy the same treatment as a spouse of a civil servant. Well, the deadline has arrived, but the government had not done anything. I reckon there would be an appeal. Yesterday, I said to the director of the FECD, saying that there is this court case. Would you consider members' amendment, or would you at least seek the opinion of the DOJ? I don't expect that he would accept my suggestion, but at least go and seek DOJ's opinion. But he said, no, we won't. We would maintain our decision made in the scrutiny. But there was a definition, and I proposed an amendment. And he said that even without an appeal, his stance would not change. I think it is totally unreasonable, because, well, same-sex partners, for couples who get married overseas, the partner should enjoy the same status. And I think that partner should be elevated to the same status as a blood relative. The director did not budge at all. So if the government does not appeal, then you should agree to what I say. Otherwise, there will be more JR cases. Now back to frontline staff of the FEHD. They've been criticized again and again to use violence or excessive force to catch members of the staff, sometimes elderly people. Last year, at the end of the year, there was an elderly lady. She was surrounded and by FEHD staff members. They wanted to grab the garment that belonged to the elderly lady. Of course, the elderly lady would lose. Passers-by saw the whole thing. They were very angry. They said that these FEHD staff members have been trained to be swift and merciless. Of course, the elderly lady was scared, and she curled up and could not do anything. And of course, in the end, the elderly lady was allowed to get her stuff and to leave. Yes, the law should be enforced. However, no excessive force should be used. People get the impression that the FEHD enforce the law selectively. I do think that they should reflect on this seriously. In October last year, there was a summons given to an elderly cleaning lady in Southern Playground. The elderly lady earned $8,000. The elderly lady was alleged to pour a bucket of water away and was given a $1,500 fine penalty ticket. The cleaning lady was cleaning the staff room of the southern playground. And so she had to do her work, and she poured a bucket of water away. She was given a summons by the FEHD. The elderly lady cried. The cleaning company was willing to pay the fine for her, and in the end, the FEHD said that they would withdraw the fixed penalty ticket. But what everyone could see was that they exercised every ounce of their authority and power. And I also like to speak for outsourced workers of the FEHD. Last year, there was a survey done. People visited refuse collection points to understand how these cleaning workers do their work, and they also go to public toilets to find out their work environment. The problem they found was very serious. The government say, that is, the FEHD is actually the employer. They're responsible outsourcing these contracts. They would oversee the work, say, for example, the number of workers deployed, the cleanliness of these facilities. Yes, the FEHD may issue warning and summonses, but the rules are all made by the FEHD. These outsourced workers are subject to exploitive terms. Of course, the FEHD is fully aware of that. Let me give you some examples. If a cleaning worker wearing uniform, well, they could eat inside the refuse collection point. Of course, the environment is appalling. If the cleaner wants to leave the refuse collection point to eat, they can, but they cannot wear their uniform when they do that, so they have to change. They have to get changed. However, the FEHD did not provide them a place to get changed. So these cleaners will have to either eat inside the refuse collection point wearing their uniform or get changed. But there is nowhere for them to change, no changing room, and they have to store their valuables and their belongings just at the back of the vehicle or in a corner. Has the FEHD actually thought about this? And some workers will have to eat on board a dump truck or refuse collection vehicle. Their personal belongings from time to time will get stolen. And the labor union found that less than 30% of these refuse collection stations do not provide drinking water. So you have to bring your own water. And where do you keep the bottles of water? On board the refuse collection vehicle. It's not summer yet, but still it's very hot. The government will make video clips to remind workers that we have to take rests when it's too hot. What happens in reality? If outsourced workers stop working, photographs will be taken and they would be penalized. Well, they will receive a warning if they don't take off their uniform when they eat outside the refuse collection station. And in summer, if they just sit down, they might receive a warning. And there is another serious problem. Well, FEHD said, as you know, their public toilets operate over the night. There was a night shift, 7 p.m. to 11 p.m. But for a lot of these public toilets, the night shift will not work anymore.
And this has added to the workload of the morning shift workers. Of course, we know that the cleansing companies or contractor wants to cut corner, but does FEHD know? Did FEHD know? Take Kawanja as an example. There are only 2 public toilets with night shift staff, and we've complained to the FEHD, and the reply was, yes, that was done with their approval. And then the cut in manpower has spread to places like Wong Tai Shin and Kwai Ting districts. So this has nothing to do with the frontline staff, but that's the problem with the management. I'd like to condemn the FEHD on the following matter. Do you remember that last New Lunar Eve, assistants of Leung Chong Hang succeeded in getting a store in the flower market, New Year flower market in Victoria Park. They were only informed that their agreement would be cancelled 2 days before the opening of the market, saying that they might disseminate messages involving independence of Hong Kong that would bring constitutional crisis. And then they denied, and they even showed the department the invoice of the commodities order that they're going to sell, and they guaranteed that there would not be any offending products, and the department was free to take action if they had any contravention. However, still the tenancy was voided. Actually, such commodities have been sold every year at flower markets. However, if there is no clarification, then everyone can be the youngspiration. Even though you have already ordered commodities to be sold, they will say that you're going to affect stability and prosperity and going to advocate independence, and then your store agreement could be cancelled. I think they act under the direction of more senior officers, but then the department should be reasonable. Thank you. Chairman, many members won't have enough time to speak in this debate, so I think your judgment has been wrong, and I urge you to prolong the debate to allow us time to speak in this debate. I have a lot to say, in fact, but I can only focus on the 2 amendments by Dr. Lau Shulai, Amendment 121 and 122, deduction of pay from the secretary and the undersecretary for 1 month, relatively minor in nature. I think you know what I am about to say, and that is there in adequacy in promoting universal retirement protection. Under your leadership, Chairman, the pro-establishment members have been very lazy in this year's budget debate. They have no fear of the quorum bell, and they have no fear of filibustering. Why have they chosen not to speak? Because the more they do so, the more likely are they going to say something wrong. This government has made a decision on the subject of universal retirement protection, and if we pass the bill, then we will put in place a 3-tier system for retirement protection, and this is a very big problem. In the past 5 years, in every year's appropriation bill, I have been filibustering, or I have been speaking, repeatedly urging the administration to adopt universal retirement protection. And this is very different from the 3-tier system the government is going to introduce. This, in fact, this council and even the previous councils were in support of universal retirement protection. Even Mr. Tam Yu Cheong, the former chairman of the DAB, who is no longer legislator, and he was once an executive councillor. In 1996, he moved a motion urging the administration to implement universal retirement protection, and I quote from what he said. However, I must point out that relying on CSSA payments can only help a minority of elderly in destitute elderlies, and we won't be able to help everyone. And we're spending $4 billion on CSSA already. If by 2030 the population of the elderly is to be grown by threefold, then we're going to spend $12 billion, and that is equivalent to 4% of what the government is going to contribute to an OH pension. Will these cause a tremendous financial burden on the administration? Therefore, we must introduce a central provident fund and OH retirement scheme in a timely manner. That is what he said. And he continued to say that Chairman DAB and FTU has together proposed a system for the elderly, and that is the best solution. And this package has got the support of 78 scholars who opposed the government's proposal. It's got the support of Professor Nelson Chow. That was in 1994. Even back then, Mr. Tam was saying that. And you may say that, well, that was before the handover. However, in 2001, Mr. Jasper Zhang, the former president of this council, he was also back then the chairman of DAB, on the 21st of December 2002, he said in the debate, the DAB attaches a lot of significance to the poverty gap in Hong Kong. We have the view that the government should formulate a comprehensive package for poverty alleviation. On top of that, in the long term, Hong Kong should have a comprehensive and universal retirement protection scheme. So that's what they said. Most interesting of all is, and this is a clue we found in history. On the 19th of January 2011, Mr. Po Chen moved a motion entitled Review of Public Finance Policy. His speech was very long. I can only quote a paragraph from his speech. Now, he is the financial secretary now, and that's what he said back then. Yes, financial discipline doesn't mean that we have to be stilted. We have to make adjustment in the light of changing circumstances, and we must take care of the very vulnerable, the very poor, the disabled. We must not we must not turn a blind eye to their plight. And he continued to say, looking at the reserves the government has, some of them can be realized without affecting public policy. For instance, the ownership of MTRC by the government can be reduced from 77 to 50%. The government can hold on to its 50% ownership, and that applies to the airport authority. That will not affect the interests of consumers, but then at once there will be $100 billion realized. We can use this money to take care of, to provide services, or to provide universal retirement protection for the elderly. So this will show the government's commitment to tackling the problem of aging population, and also the need for universal retirement protection. Now, he is the FS now. I don't know whether he is here and whether he can still remember what he said back then. Anyway, I found this in our record. And then another ball, and that is Mr. Chen Kim-po said in the same debate, as regards Mr. Wong Kwok Hong, he proposed a review of social welfare and protection benefits. And he's of the view that there should be universal retirement protection to lower the government's commitment in social welfare, and that I support. And this is the incumbent chairman of the FS who guillotined my filibustering, and the chairman of FC, Mr. Chen Kim-po. And then FTU amended Mr. Chang Mao-po's motion debate to review to establish universal retirement protection so as to alleviate the government's welfare spending as a result of the aging population. In other words, he supported Mr. Paul Chan's amendment, and FTU, DAB, Paul Chan, Chan Kim-po, they all supported universal retirement protection. The debate started in 1994 to 2011, and then from 2011 to now. So am I correct, or are they correct? And that's why the least said, the better. Because whether it be by a slip of tongue or a sudden awakening of conscience, or to deceive the voters, what you say here will be in our handset. So now Paul Chan is now the FS. When he was against the Zhang administration, Donald Zhang administration, he wanted that position, and he scolded the FS for being a miser. I must say something on behalf of the elderly who have no retirement protection here. The CE designate, Carrie Lam, also has to be blamed. He is the chairman. She was the chairman of the Poverty Commission, and there was a poll done by Hong Kong U. Close to 7% of the respondents supported a universal retirement protection scheme with no means testing. Close to 90% of them agreed that no less than 2% of profits tax should be levied on profit-making organizations, and then there should be $50 billion injected into the seed fund. Well, I asked for $50 billion is here, and we still need another $50 billion, and now it is going to be put into a fund for abolishing the offsetting arrangements. So the government just accepts what it pleases. Professor Nelson Chow was asked to do a study, and then the government said that the figures were wrong, and the report was only published 1 year after a submission. So Professor Chow was tricked, and the government rejected a report commissioned by itself. In the community, there was a scheme for universal retirement protection. We are going to have a 3-tier system proposed by the administration for retirement protection. Even the administration admits that by 2046, the money or the scheme may not be viable, and taxes may have to be raised. Whereas for the proposal from the community, it would be fully sustainable, and there would even be a surplus in 2041. All right, Chairman, you have decided to guillotine this debate so that I don't even have enough time to elaborate on this. We have hundreds of thousands of elders being tortured by poverty. Some of them were not in the workforce. Some elderly women who were not part of the workforce, they are not protected by MPF. Yong Ki, where you frequently patronized, has got some refuse bins just across his shop, and there are elderly persons scavenging the cardboards every evening. So, secretary and undersecretaries, have you ever chatted with them when your chauffeurs meet you? Have you ever looked towards their direction? The three-tier system proposed by the government has at least got three inadequacies. First, so if the government is to be responsible for pension, retirement protection, then by 2041, the annual undertaking will be $460 million to $681 million. That would mean a greater financial burden on the government. Secondly, ministers will divide our elderly, and there is also the possible risk of shifting assets, and elders may advertently break the law, and their wealth may be cheated away by their children. And for elderly persons have contributed their youth, or housewives who contributed their youth to raise their children, to build their families, and also people who had no savings when they were young. We should ask a large consortia to foot the bill. They should be asked to contribute for wealth redistribution. The so-called three-tier system will just worsen the wealth gap instead of a fair redistribution of wealth. So I urge members here to support Ms. Lau Xiu-Lai's amendment to cut the secretary and the secretary's pay. Ms. Claudia Moore, are you going to speak? Long hair mentioned Carrie Lam. And then I recorded in the recent CE election, Carrie Lam, the CE-elect, had never mentioned animal welfare or animal rights in her manifesto or in her platform. So she would not even window dress on matters involving cats and dogs. Some people may misunderstand our amendments in relation to head 22, management of wild boars. We must not call animals pets. Many of us have met wild boars when we are hiking. Yes, they are quite horrifying because the male boars, they have very sharp teeth, and the piglets are very funny and very lovable, but still you are not going to take them back to your home to keep as pets. The fangs are very horrifying. AFCD has got a hunting team for boars. Unfortunately, they have not called stray dogs wild dogs. We call them community animals. If you call them wild dogs and cats, the animal rights volunteers will take you to task. But the government or the department call these wild boars. How come we have wild boars in Hong Kong? The hill slopes in Stanley used to have a big pig farm. If you were living in Stanley, you would hear the pigs oinking. But now the farm or the land has been resumed for luxury flats, and so the villages or the pig farms just left, and they just release the pigs. In fact, the pigs can swim all the way to Sai Kung, and this is one of the reasons why we have wild boars in Hong Kong. We can also call them community boars. And wild pig hunting teams, well, they are volunteers, but they can carry guns, they are licensed, and in fact, they are like a club. In Hong Kong, we do not allow hunting, but we have this wild pig hunting teams, and $2.7 million is required for managing them. Well, I was thinking that the team members were serving as volunteers, and I checked with AFCD, 1.8 million out of the $2.7 million will be spent on helping these pigs to feed them with contraceptives. Yes, that's reasonable because they can breed really fast. However, the remaining $0.9 million would be spent on management of wild boars on a daily basis, including tackling and investigating nuisance cases. So they usually use terms like public health, inconvenience to the traffic, and inconvenience to the public. So this $0.9 million is rather unnecessary because the teams would only be mobilized as a last resort. Can you use traps? You may say that, well, traps won't do. Or can you use a fencing? Can you use a wire mesh? Of course, we've received complaints from villagers that somewhere in Sai Kung or in Lantau, these wild boars are scavenging their dustbins, are causing a lot of noise. But can you use a metal gate or a wall to fence off the boars so that they will not scavenge your dustbins? It's quite rare for boars to disrupt traffic, but they may be hunting for food and causing the refuse bins to roll everywhere. But is it that you have no other ways, and to the fact that you must call the hunting teams because once they are mobilized, they will shoot? So this is a bit overdoing it. And AFCD's reply told us that they would take preventive measures or precautionary measures, and we can think of plenty, such as wire mesh. Of course, we'll not ask people to feed them, so that after they are full, they will not scavenge your refuse bins. But of course, if you feed them often, then they will treat you as their masters and come every day for food.
But you would only ask the hunting teams to act when the preventative measures do not work, but then you have to obtain the police's consent because they carry guns. You need to notify the nearby residents or villages in the new territories through the Home Affairs Department, so a lot of work is required. There were 2 recent cases, since the turn of the year. Some people heard about the operations of the hunting teams, and a lot of animal volunteers and villagers try to stop you from killing the boars. So it was almost a conflict between residents and the police. So it was really unnecessary. In order to avoid any bloody conflicts, the FCD decided to call off the operations. You did not confirm that your operations were fully supported by villagers, and we should actually go beyond the villages. We should think about our entire society or Hong Kong people on how they feel about the community boss or pigs. And you cannot just go out and kill the boss. That's not the way to go. In terms of wild boar hunting, in the past 5 financial years, I asked about the operations of the wild pig hunting teams and the number of wild boars hunted. So it was a play of words. What is meant by hunting? So what would happen after you capture the pigs? You would kill them. So this is not hunting. This is called killing, or humane killing. So you try to use these ambiguous words to get yourself out of trouble. And back in 2012, 110 operations were carried out, and this year the situation improved after many complaints. The number of operations dropped to only 49 this year, but the number of community boars hunted didn't go down by half. In 2012, 55 boars were killed, and this year 34 were killed. And the figure is accurate as of the 2nd of March. So the figure as of now should be more than 30. Well, I haven't seen any operations since March. We should call them community boars. We also have community cows. Cows are milder than boars. Even if you sound the horn, they would often ignore you. They are very calm. And cows have an even longer history in our community. We used to be an agricultural society, and when I was small, I used to learn about cows and agriculture, but Sha Tin no longer has any agricultural activity. It's now full of shopping malls. What about the cows? We would, you release them so that they would live on their own, and they have existed since then. You can also carry out contraception or even neutering on the cows. The FCD has a cow management team, but according to the volunteers, they are very cruel. They would remove the calves and carry out neutering when they are just 4 months old. So you are separating the calves from their parents. For calves that are 4 or 6 months old, they should not be neutered that soon. So why the urgency? And the AFCD told us that some cows might look very young, but in fact they are already fully grown. And the volunteers laughed at these claims, and they knew the dates of birth for each cow, and they knew where those cows were born. And in Sai Kung, there are mini cows, and there are some very small cows, but you said they are already grown. The only explanation is that they are mini species or breeds. So such arguments with volunteers are really unnecessary. Well, if you made mistakes with the cows, you should admit them, but that was not the case. After you removed the cows, you carried out neutering, but the calves were not returned to their mothers. And at Sapatang in the New Territories, when you look at those indigenous villages, there's a lot of grass, and I saw pictures of 2 cows taking a nap in the afternoon. They are very close to the roads, so it's a bit dangerous. And in the past, some volunteers asked to relocate them to a big lawn or farm. So the cows used to live peacefully in their own habitats, but we decided to build roads, and now we are blaming them for hitting the roads. This is unfair to the cows. And there's a water activity center in Sai Kung. We took a visit to the site by bus, and private cars were not allowed. That was the end of March, and there was no grass, and the cows were bleeding in their noses because there was no grass at all. Well, we fed them with grass, even though that should not be encouraged, and the cows just flocked to us. And the calves were being bullied because their mothers weren't here. So you really have to question the AFCD and the FHB on what kind of policies they have on our community balls or community cows. Thank you. Dr. Lau Chiu-Lai, do you wish to speak again? Thank you. I want to speak on my 3 amendments under head 139 subhead 000. Deducting 1 month of salary for the secretary, undersecretary, and political assistant of the Food and Health Bureau, and this is only symbolic in nature. I just want to bring across the idea of cost effectiveness so that our officials could review their performances. It's difficult to gauge Dr. Cohen-Mann's performance, but today we have heard about the medical incidents from the medical sector and fellow members, and there were a number of issues. But in terms of Food and Health Bureau, my impression is very bad. I used to attend a protest at Lesho with Mr. Ho Ying, who is a hawker in Shan Shui Po. I tried to line up a meeting between Dr. Ko and Mr. Ho, but Dr. Ko refused. And in 2015, he promised to promote our bazaar policy, but the crackdowns have been ongoing. The grassroots hawkers try to meet the government, but they ignore them. Mr. Ho said Dr. Ko was not competent, and he's out of touch with reality, and he's been ignoring the people. I still remember Mr. Ho's words. In 2015, we started talking about support to hawkers and promoting bazaars. But the subsequent crackdowns on hawkers actually heightened. So the government has been hypocritic. And even the night bazaars during Lunar New Year received crackdowns. And I joined the lobbying 2 years ago. I tried to help the hawkers, and 2 years ago it became a form of civil disobedience. And I had a lot of feelings. Back then, dozens of hawkers were receiving trials, and the government would often arrest elderly hawkers. So we are talking about old ladies and men, and they admitted they pleaded their guilt, and we think that these CSSA recipients are burdens for our society. They've been asking for universal retirement protection, but we are asking them to provide for themselves. Some people became security guards till they are very old, and after that they would be accused of various offenses and they would be jailed. Some of them become hawkers, but then we are trying to arrest and try them. So are we really helping these people? I was very angry at that time, and that's why I decided to help the hawkers. These grassroots hawkers had no dignity. We have been talking about promoting various policies, but in fact we never helped them. And they are leading in dignified lives, and they are in deep plight. I once visited a legitimate bazaar, Kin Kwang Hui, and I talked to one of the hawkers, and I asked him how much he made, and he made $30 that day. And I asked why he made so little. Very often, hawkers had to start business very early in the morning, and they could not. They have to work in the dark, and because what they are doing is not legitimate. And the bazaar was named Kin Kwang Hui because hawkers can legally set up store and they would be satisfied even if they are making very little money. It made me wonder why we are not giving a way out for these elderly people and grassroots. So I thought about this. Do hawkers and bazaars only serve to help the grassroots? And a lot of academics have said that these operations are beneficial. We have been facing intense international competition in recent years. So we are often talking about very grand projects, for example, the AIB, or billions or hundreds of billions in infrastructure projects. And I do not doubt the impacts of these projects, but these grand projects had nothing to do with the livelihood of the grassroots. With the domination of conglomerates and groups, for example, domination by the Ling REITs, the public has to put up with limited commodities and high prices. A lot of grassroots women and elderly people have to take care of their families, while we have the longest working hours in the world. So hawkers and bazaars would offer greater flexibility for these people. So under global competition, we certainly need to do something. But it also means that a lot of people cannot make ends meet or even find employment. Community economy provides a viable alternative for many people. Our elderly people and women would be able to make money in a flexible manner and provide for their families.
Another merit is that Well, you know that Hong Kong's happiness index is very low. People can use their creativity and their skills to make something to sell. And that is a chance for them to tap into their potential. They will not be a baggage to society. They will not just live on CSSA. They get satisfaction from that, even though they make very little. The old man selling waffle in Taihang said that he is very happy doing this job. He was led astray before, but he's different now. He can feel that he has the magic to make other people happy. And it is not something that policies or initiatives can give people. Then why don't the government do something along this line? Apart from the right to make a living and a chance for them to tap into their potential, we also see that young people can use the chance to have a career. Nowadays, there is very little chance for a youngster. Youngsters would like to have a space for them to tap into their creativity, to become their own boss, to create their own businesses. If they busk, you will say that they illegally perform or is begging for alms. But have you considered that this is actually a way for people to make a living? So it's not just a way to make a living, it's not just a way to develop. We've been saying about high-tech sports park, major infrastructure. I would like to draw your attention to James Jacobs, a very famous U.S. scholar. Well, he said that the more shopping malls a city has, then the less interaction there is between people. Say, for example, you won't be able to ask the shopkeeper to give you something to try because that is only a staff member of a chain store. People will be less happy. We see a lot of luxurious flats, but that is empty. Bazaars will provide an opportunity for people to interact. You will talk to the store owners, the operators. You will start chit-chatting. You will establish a bond. So whether it's the operator is an elderly person, a housewife, or a youngster, it's a way for them to help each other. You said that you keep an open mind, but that is not the case. You talk about bottom up. That means you will have to knock on the doors of every department to get whatever you need. In other words, government will leave you to your own devices. It's very difficult to get the licenses you need from these different government departments. It's very difficult for people to start a bazaar. When a civic body finally managed to have a bazaar, then they will be cited as examples. The government has not helped them at all. But when someone has finally made it happen, you use them and claim their glory. They don't ask for a lot. All they need is for you to give them information about the area where they can use as a testing site for bazaar. We've been forcing them, and finally we get information contained in 155 pages. Government departments are in a very good position to give us the information, but we're made to fish, to look for the information. We want free flow of information. We have to make an effort to find the information. And then eventually the government said, well, we may review the situation. What has government officials with a fat salary done? Apart from receiving your salary and getting your promotion, government officials should take into account whether you have made people's life easier and happier. You only have to move a finger. You will make a lot of people happy. However, these officials remain aloof and refuse to help. Over a decade, a lot of these voluntary organizations has made every effort to inch forward. We're talking about a large group of voluntary workers sacrificing their own time to find the information. These groups ask for a seed fund so that they can actually recruit people to help them, so that there will be a bazaar in each district. But the government said we have no plans to study into it. We have no plans to set up a seed fund. However, we spend a lot of money on AIIB, on Disneyland, on Hong Kong-Zhuhai-Macau Bridge. We asked you for a small amount for a seed fund. You refuse. I dock a month's salary so that it can be used as a seed fund, so that grassroots have a chance to be happy. Don't be divorced from reality, please. Dr. Siu Ka-chun, would you like to speak again? Yes. Well, the LegCo is a place to have debates. This is our job. Mr. Leung Chee-Chiang said that increasing staff for inspection of homes will help identify flaws. And he thought that my proposal to dock the expenditure to recruit more people for the inspection is not warranted. My amendment is to reduce the expenditure that equals to the recruitment of 8 members of retired discipline services. My point is that the focus should be on enhancing the quality of service and the quality of life, and it cannot be attained by merely enhancing inspection. The SWD has already increased inspection and regulation after these incidents. I have made some visits myself, and I can see that these measures fail to address the problem. I hope Mr. Leung Chee-Chiang will know that the licensing and regulatory section have about 121 member staff covering nursing, buildings experts, and welfare services. My proposal focuses on taking away the 8 staff member of discipline services. The LWD and the SWD have failed to explain to me the reason why they need this special type of people. I did not propose to reduce funding allocation to other types of staff members. When I first speak, I propose to recruit physiotherapists, to organize various activities to homes, and to provide training and to formulate rehabilitation and treatment plans. I hope Mr. Leung will understand. When it comes to the bridge of rehabilitation incident, the SWD has done a lot, but As Ms. Lau Xiaolai said, the international trend is to take away the homes and focus on community treatment and care so that elderly people and PWDs can stay in the community. You need to give them sufficient care and support. Are our homes good? As at the 31st of March 2017, 4,504 people are still waiting for residential care homes or the improved home and residential care services. These people have been classified as people in need. They still have to wait on average 11 months to get the service. In reply to Mr. Siu, the Secretary said about the community care voucher or the residential care voucher. I want to say that in our sector, there has been a very loud outcry because we don't want commercialization of the service. Between 1989 and 1997, Gustad wrote a book saying to the effect that it's poverty under prosperity. He criticized John Tsang and Carrie Lam for thinking that the government should not do anything. They are criticized to be too conservative. The long waiting time has been heavily criticized, and it is a problem. Elderly people and PWDs without sufficient support will have to go to a home. But what about the waiting time? According to the SWD, as at the end of March 2016, subvented RCHDs have over 9,000 people waiting. You have to wait for 7 to 8 years. For some areas, you have to wait for 15 years. That means they're still dealing with cases that entered the queue in year 2000. For severe and medium impairment, between 2014-15, number of people waiting stood at 1,784, with the number of places available standing at 2,384, and annual addition of places stood at 20. So you have to wait for average 39 months. So supply cannot catch up with demand. The waiting time's longer and longer. Looking at past budgets, when it comes to planning for homes, I think the government has not made good its words. Over the years, the administration agreed to increase number of places. However, they failed to do that. They have not made good their promise to increase places, and there's a shortfall of 2,400. The unit cost of every place is about 170,000. If they want to shorten the waiting time, number of people waiting by half, every year they only need $100 million. Well, there's been a lot of major projects. They don't want them to be called white elephants, but we're talking about hundreds of billions dollars spent on each project. Cost overrun alone is over 10 billion. We don't lack resources. We lack the will to make it happen and the sincerity to make it happen. I think it's a question of priority.
When we are so short of residential homes, the government has been building very large hostels is planning to turn Siu Lam Psychiatric Hospital into a mega-size home with 1,150 places for severely disabled. And in Kwun Tong, a shared workshop is now being converted to a 300-place hostel for the severely disabled. I don't think many people like to live in such institutions. For the sake of efficiency, the disabled inmates will have a very unplanned routine, and there is no way their quality of life can be improved. I'm worried that living in such big institutions would undermine the quality of life and the rights of such people. Under Article 19 of the Convention, United Convention on Rights of the Disabled, it is said that the disabled should enjoy the same rights as their able-bodied counterparts, and there should be effective and appropriate measures to ensure that the disabled can also enjoy such rights and to fully participate in the community. At public hearings, many disabled persons reflected their views that such large institutions were against human rights. They would be isolated from the community, and they won't have the chance to be masters of their own mind, and they would call such large institutions prisons. What we want is planning and more places. What we object is mega-sized institutions. This is not being contradictory. We want to have a new mindset of service provision with more possibility and to protect the rights of the disabled and to give them proper care. In places like Canada and the US and Europe, even in the 1970s, they talked about deinstitutionalization and community-based care for the disabled. They should be allowed to live in the community with their family members as far as possible. They have small community-based institutions to be as close to home care as possible so that the disabled can enjoy autonomy. Each small home will have 6 to 8 members, and there will be a team with caseworker and social workers and medical healthcare workers. So home-like institutions is a change in mindset, a shift in paradigm. To safeguard their equal rights, we should improve obstacles they have in the community. We should replace it with this medical-oriented model of care for the disabled. And this is what we should explore as a way out. It's not that Hong Kong doesn't have a small-size home-like institutions. Different NGOs have been operating small homes for the disabled, but this is not government policy, and therefore they cannot be widely promoted. And in Hong Kong, the government's policy goes against the worldwide trend. They are building mega-sized institutions. In the coming few years, we will see a rise in PRH production. We should spend 1 to 2% of these PRH flats and convert them into small home-like homes for the disabled. This will greatly increase the supply of places and can also respect the wish of the disabled. I truly understand that PRH supply is very tight, but we also have to take care of the needs of the disabled. They need care, and their rights should also be duly respected by the community. If we use or convert 1% of the PRH flats into homes for the disabled, we will only need 600 such units to provide 2,400 places to greatly improve the current waiting time and to safeguard the rights of the disabled. Support for carers is also inadequate. Carers have to take care of the disabled family members day in, day out. Because of lack of support and respite, I think their tolerance has reached a tipping point. We just don't know when the line, when they will break. We have seen various degrees of tragedy, including suicides and also domestic tragedies as a result of the pressure faced by carers. So we must improve the support and situation for these people. This is very pressing. Thank you. Mr. Diju? Thank you, Chairman. This morning, when we left home, we would all have felt how serious air pollution was. I think every in Hong Kong, the API is over 150. And today, the situation is particularly interesting. Other cities in PRD are not as filthy as Hong Kong is today. That means in urbanization, Hong Kong has created many problems, environmental problems, which we cannot bear. Mr. Ray Chan proposed to cut the funding for AFCD, and that is to cut the pay for the director of AFC. I'd like to speak on Mr. Ray Chan's amendment. And the question is, what kind of an AFCD do we want? I've got a friend who is a farmer, and he also teach people how to farm. He has got a very good metaphor to tell us what is the farming situation like in Hong Kong. Now, when we go to a Chinese barbecue shop, we ask for a dish of char siu rice or roast pork rice, and then on the rice, there may be one or two pieces of leafy vegetable as a side dish. And in Hong Kong, environmental protection is just like the veggie next to on the char siu rice. If it is not there, will you complain? Perhaps not, because the mainstay is char siu. Or barbecue pork. And what is barbecue pork? And that is extensive urbanization and a traffic model that is vehicle-based, and also severe air pollution. The director of AFC is very much in the character of the veggie next to the barbecue pork, because in head 22, according to the director, his objective for program 1 is to promote the production of agriculture and fisheries products and to enhance the productivity of the two industries. But has he been doing that? Has he been able to achieve that? The answer is no. If we look at some simple statistics, then we will know that our agriculture and fisheries have not seen their productivity or production boosted. Production of local veggies, for instance, in 2013, it was 16,300 tons. In 2016, the figure dropped to 14,200 tons for that year. So the amount of production has been dropping. percentage of vegetables produced locally. In 2013, it accounted for 2% of our consumption. Now we can't even keep that figure. The latest figure was 1.8% in 2016. So if we consider a value for money assessment, so under Program 1, the department is to promote the production of local fisheries and agricultural products. So he has failed in this objective. And then in Program 2, one of the points to note in 2017-18 is to promote our new agriculture policy to support localization, modernization of local agriculture, and to coordinate the establishment of the agri-park, and to commission a study on our priority farming areas. The government has launched the new agriculture policy in recent years, and we thought that at long last somebody is interested in agriculture again. But we see a major problem here. And that is, how can we measure progress in the development of agriculture in Hong Kong? I think there are only two standards. Either it is the total production, it must be on a rising trend, or a percentage of self-sufficiency. The reliance on locally produced veggie must rise in order to be successful. Under the new agriculture policy, we don't have such indicators. What's more, if we are to revive our agriculture in Hong Kong, what are the greatest difficulties faced? Dr. Ko is here. The biggest challenge faced by our local farming is not whether you're going to provide $500 million for them to apply for, and it's not about whether you're going to spend $10 billion $1 billion from our public coffers to build an agri-park. Rather, we've got around 4,000 hectares of fallow farmland. Do we have a policy first to conserve them so that they will not suffer further destruction and they will not be further reduced? And the second issue is how we can rehabilitate such idle or fallow farmland. There is nothing about this in the new agriculture policy. We know full well that the problem is fallow farmland all over Hong Kong. There are farmers who would like to have bigger farms, and there are also new blood who would like to become farmers. We have a joke. In Hong Kong, we talked about developing or expanding the Disneyland and also the Kai Tak Sports town. These are very big projects.
A lot of people are interested in 3 industries. First, hawkers. 2, farmers. Some people would like to own a small vegetable farm. And 3, like the people who, or the group who was arrested in Kwun Tong, can we run our own cultural activities? We should allow these small industries to thrive on their own, and that is the wishes of many people, especially the younger generation. Right now, is the government offering a policy to fulfill these people's wishes? Well, agriculture has become so political because whenever we talk about farming, we have to deal with the issue of land. And when we have land issues, the AFCD or Food and Health Bureau would delegate to the Development Bureau. They would ask the Development Bureau to take up the bulk of the work, and they would just supplement. As a result, the new agricultural policy does not address the big picture. We do not need gigantic or 100-hectare agricultural park. We just want some protection for our farming sites and a policy. And such policy requires the commitment of the FHB and AFCD. They should try to wrestle some land back from the Development Bureau. Another issue I want to touch upon is that for the director of AFC, when he wants to develop our agricultural products, is he contributing to various issues? We talk about anti-development nowadays. Very often they are related to brownfield sites. And as many fellow members have said, when you develop new towns in the new territories, there are a lot of brownfield sites. If you do not come up with proper arrangements for brownfield operators, and they would proliferate everywhere. Let's say if you evict 100 hectares of brownfield operation, they will go elsewhere. So that is when the director of AFC should step in, but we haven't seen anything from the director. A lot of members talked about the repositioning policy for brownfield sites, and that the arrangements cannot address the needs, and as such, they would simply relocate themselves. When the director of AFC says they want to develop agriculture, you should have more guts. You should pay attention to discussions in our society, and your mindset should not be dictated by development. Finally, I want to talk about another issue also related to AFCD, and that is our country parks. The director of AFC is responsible for managing country parks. But what is the problem we face nowadays? From chief executive to the Development Bureau and CY Leung's fans, they have been reinforcing the view that Hong Kong has some country parks with low ecological value, and these areas can be developed. So such logic is erratic. They never told us why those areas were of low ecological value. And there is actually a reason, and the reason was a lot of those sites face a lot of hill fires, and the director of AFC should draw up a proper policy to avoid hill fires, and they should work on the plantation to restore the ecological value of the sites. But this is not the case. They allow people to wrestle away the areas with low ecological value. They are deceiving the public, and there is no vision going forward, and they have no guts. We don't want a director like this. We hope the government has heard us. You should focus on the important things. This debate has now come to a close.